Each day, millions of Americans go about their lives, unaware of the subtle signals their hearts might be sending. Heart disease is a leading cause of death in the U.S., claiming nearly 700,000 lives each year, 1 in every 5 deaths. To put this into perspective, on average, 1 person dies every 33 seconds from heart disease. These staggering statistics underscore the importance of heart disease awareness and prevention. Yet, many people miss the early signs of heart trouble. Signs that could make all the difference if caught early. You've probably heard the term heart disease. So what does it really mean? Simply put, it's an umbrella term for a range of conditions that affect the heart's structure and function, ultimately impacting its ability to work properly. Whether it's the arteries, heart muscle, valves, or rhythm. It includes things like blocked arteries, coronary artery disease, irregular heartbeats, arrhythmias, and heart failure. But heart disease isn't the whole picture. It falls under a larger category called cardiovascular disease, which also includes stroke, high blood pressure, and circulation problems. So, while heart disease and cardiovascular disease are often used interchangeably, they're not the same. Cardiovascular disease affects both the heart and blood vessels, while heart disease refers only to heart conditions. The key takeaway? Heart disease is one of the most serious and common forms of CVD, and recognizing the warning signs early can make all the difference in protecting your heart health. At 38, Lisa was in peak shape, a former college runner turned weekend marathoner. She prided herself on her endurance and discipline. But lately, something felt off. During her morning runs, her heart would sometimes flutter unexpectedly. A strange rapid sensation in her chest. It always passed quickly, so she brushed it off. Maybe too much coffee? Not enough sleep? Then, during a 10K race, her heart suddenly started racing out of nowhere. She felt lightheaded, her legs wobbled, and for the first time ever, she had to stop mid-race. Still, she shrugged it off. "I'm fit. It's nothing." Weeks later, during a routine checkup, her doctor noticed an irregular heartbeat. After further testing, Lisa was diagnosed with atrial fibrillation, a condition that increases the risk of stroke and heart failure. Lisa's story is proof that even the healthiest people can have hidden heart issues. So, ignoring subtle symptoms, like irregular heartbeats or feeling dizzy, could mean missing a chance to protect your heart before complications arise. Thanks for tuning in to DelenHeart and Health. Today we're uncovering the hidden signs of an unhealthy heart that you shouldn't ignore. These symptoms might seem minor or unrelated, but they could be a warning from your body. Plus, stay tuned for a quick heart health check you can do at home. Let's dive in. We all feel tired from time to time. But if you're finding yourself constantly drained, even after a full night's sleep, it might not just be from being busy or stressed. It could be a sign your heart isn't pumping as efficiently as it should. Here's something you might not know. Research from the American Heart Association highlights fatigue as one of the most overlooked early signs of heart disease, especially in women. When your heart isn't pumping enough oxygen-rich blood, your body has to work harder, leaving you feeling drained, even after you've rested. Let's do a quick check. Ask yourself, do you feel exhausted even after a full night's sleep? Do simple activities, like walking to the mailbox or carrying groceries, leave you totally wiped out? If you're answering yes to these, don't brush it off. It's worth checking in with your doctor. Better safe than sorry. Now, while your medical provider is the best person to guide you, here are a few things to consider bringing up when you talk to them. Begin by optimizing your daily routine. Prioritize activities that give you energy rather than drain you. If you're feeling tired all the time, track when it's happening and bring it up with your doctor. Adding light movement breaks offers extra benefits. Simple things like short walks or even some gentle stretching can help with circulation and give you a little boost of energy. Ask your provider if this is right for you. Here's another powerful habit to consider: morning sunlight. Stepping outside and soaking up some natural sunlight in the morning can help regulate your body's internal clock and support better sleep. That might just be the key to improving how rested you feel throughout the day. Ever find yourself getting winded after something that used to be a breeze? It might just be that you're out of shape, or maybe it's something more. We tend to brush off shortness of breath as just part of getting older or not being in great shape. But if this is happening regularly, it could be a sign of something serious. Here's the thing. You might not know this, but shortness of breath is actually one of the earliest signs that your heart isn't working quite like it should. I know, but before you start worrying, let's break it down. Want to hear something interesting? Over 6.7 million adults in the US are affected by heart failure. And guess what? Difficulty breathing is often one of the first symptoms people notice, even when they're just sitting still or not doing anything too strenuous. It's not always about intense exercise. It can sneak up on you during your most relaxed moments, too. A surprising culprit? Sitting for long. Research shows that sitting too much can actually weaken your heart over time, even if you exercise. If you're someone who spends hours at a desk, try setting reminders to get up and move around every so often. Studies in Circulation Journal show that shortness of breath is often one of the first signs of heart failure, even before chest pain or other symptoms show up. This could be an early warning sign your heart's trying to give you. If this is happening to you, it's important not to ignore it. Let's do a little self-check. Ask yourself, are you getting winded from tasks that never used to tire you out? Do you find yourself out of breath just from walking around or climbing stairs? And here's a big one. Are you feeling short of breath even when you're sitting, relaxing, or trying to sleep? If you answered yes to any of these, then it's better to get checked out than to let it slide. Here are some simple lifestyle changes to discuss with your healthcare provider. They can help you better understand your heart and breathing while offering practical ways to find relief. A low-effort but high-impact option to consider bringing up is light movement. Sometimes just walking or doing some light stretching can help improve circulation and make it easier to breathe. Sleep position matters. Your sleep impacts your heart, so adjusting your position to support better breathing might help. Stay hydrated, because drinking enough water helps with circulation. But if you're feeling breathless, make sure to check with your provider about how much water is right for you. Unexplained swelling in your legs, ankles, or feet might seem harmless at first, but it could be a sign that your heart isn't circulating blood properly. When the heart isn't working efficiently, blood can back up in the veins, causing swelling, a condition called edema. While occasional swelling can happen for a variety of reasons and doesn't always point to serious issues related to the heart. If it sticks around or seems unexplained, it's something you'll want to pay attention to and discuss with your healthcare provider. Quick check. Have you noticed swelling in your legs, ankles, or feet that doesn't seem to go away? Here's a quick way to assess. Press gently on your ankle for a few seconds. If you notice a dent that lingers, it could be fluid retention, something worth discussing with your doctor. Your medical provider can offer the most personalized advice for your situation. During your next visit, it would help to go beyond just listing symptoms. Bringing up a few key areas can give them a clearer, more complete picture of what's going on. Leg elevation. Lifting your legs while resting can help with circulation and reduce swelling. Check with your doctor to see if this could work for you. Another helpful practice? Wearing compression socks or stockings. These specialized socks or stockings apply gentle pressure to the legs, particularly around the ankles and lower calves, to help improve blood flow and circulation. They might help reduce swelling, but make sure you're using the right type and fit. Ask your healthcare provider for guidance on this. Hydration and salt awareness can also play a vital role here. Fluid and salt intake can contribute to swelling. Ask your doctor if adjusting either might help control the swelling. Have you ever felt your heart race, skip a beat, or flutter unexpectedly with no clear reason? That sudden irregular heartbeat could be a sign of atrial fibrillation, AFib, a condition that affects millions of people, and many don't even realize they have it. AFib can increase your risk of stroke and heart failure, but it often goes undiagnosed. That's why catching it early is key. Even if you're not experiencing chest pain, a consistently irregular pulse is something you'll want to discuss with your provider. Quick test. Find your pulse on your wrist. To do this, place the tip of your fingers on your other wrist. Watching the second hand on your clock, count how many times you feel the beat for a full 60 seconds or 1 minute. If it feels irregular or faster than usual, over 100 beats per minute at rest, it's worth bringing up with your doctor. While your doctor knows your health best, here are a few things to explore during your next conversation. Caffeine and stimulant awareness. Some people notice their heart rhythm changing after caffeine or alcohol. It can help to track any patterns and discuss them with your doctor. Another option to explore? Stress reduction techniques. Stress can play a big role in irregular heartbeats. Gentle breathing exercises or other relaxation techniques might help, but always check with your healthcare provider to make sure they're safe for you. Once again, consistent sleep routine. Poor sleep can sometimes be linked to heart rhythm problems. Talk to your provider about ways to improve your sleep quality to help with this. Enjoying the video so far? Join our community for the latest health insights. Go on, subscribe, like, and comment. Don't forget to share this information to help others stay informed. Chest pain is an obvious warning sign. But here's something surprising. Did you know that up to 25% of heart attack patients don't feel pain at all? Instead, they might experience a squeezing or tight feeling, a burning sensation, easily mistaken for heartburn, or a heavy or full feeling in the chest. If you ever experience unexplained chest pressure, especially when accompanied by shortness of breath or nausea, don't ignore it or try to guess what it might be. Seek medical attention right away. While your doctor is the best resource for personalized advice, here are a few things to consider bringing up during your visit. Ask if your chest pain might be heart-related or just due to muscle strain. Heart-related pain often feels like pressure, squeezing, or tightness and may radiate to your left arm, jaw, or back. It's also likely to come with other symptoms like nausea, vomiting, sweating, or shortness of breath. Muscle-related pain, on the other hand, tends to stay in one spot, feels more like an ache or stiffness, and usually worsens with movement or touch. Here's a helpful question to ask yourself and your doctor. Does the discomfort come with physical activity, or even when you're at rest? Your answer can help your provider better understand the source and help guide further testing. Also important, when to use heat or cold therapy. If your pain turns out to be muscular, ask your doctor whether heat or cold therapy might help. Warm compresses and gentle massage can ease muscle tension, but only after you've ruled out something more serious. Always check with a professional first. Now let's talk about digestive factors. Sometimes chest discomfort is tied to how and what you eat. Eating large, heavy meals can trigger pressure or burning that feels like heart pain. Practicing mindful eating, like slowing down and noticing how your body responds, might ease those symptoms. If you're unsure, your provider can help figure out if digestion is playing a role. Ever feel dizzy, lightheaded, or like you might faint when you stand up or go about your day? While dizziness can have many causes, one important area to consider is your heart. It might be a sign that it's not pumping enough blood to your brain. According to the National Heart, Lung, and Blood Institute, dizziness is a common early symptom of heart disease, and in some cases, it can even lead to fainting. If this happens often, don't brush it off. Get it checked out. Surprising link? Did you know that chronic stress can cause dips in blood pressure? Over time, these swings can increase dizziness and even raise heart risks. Managing stress isn't just good for mental health, it's vital for your heart too. Your doctor can help pinpoint the cause, but here are a few things to bring up at your next visit. First, let's talk about slow position changes. When getting up, try moving slowly to prevent sudden drops in blood pressure. Discuss strategies with your provider. Another helpful tip: hydration awareness. Dehydration can sometimes contribute to dizziness. Ask your provider about proper hydration for your needs. And finally, visual focus techniques. Fixing your gaze on a stationary object when feeling lightheaded can help improve balance. Check with a professional if this is appropriate for your condition. Ever wake up feeling exhausted even after a full night's sleep? Or has someone ever told you that you snore loudly? It might seem harmless, but sleep apnea can double your risk of heart failure. This condition causes breathing to stop and start during sleep, putting extra strain on your heart. The tricky part? You might not even realize it's happening. If you often wake up gasping for air, feel constantly tired, or snore loudly, ask a loved one if they've noticed pauses in your breathing while you sleep. If they have, it's worth discussing with your doctor. Since every case is different, your doctor can provide the best guidance. But here are some areas you should consider exploring together. If sleep apnea is a concern, ask your doctor about the possibility of a sleep study to assess your condition. Another thing to consider: sleep position adjustments. Sleeping on your side rather than your back may improve airflow. Ask your provider if this could help. Let's talk about optimizing your sleep space. A cool, dark, and quiet bedroom may enhance sleep quality. Talk to your doctor about other sleep hygiene strategies. And lastly, nasal breathing support. Some people benefit from nasal strips or humidifiers. Check with a professional to see if these might work for you. Feeling nauseous, bloated, or dealing with frequent indigestion? You might think it's just something you ate, but in some cases it could be a hidden sign of heart trouble, especially in women. Heart-related nausea is often overlooked. According to the American Heart Association, women are more likely than men to experience nausea during a heart attack. If digestive issues come with other symptoms like jaw pain, chest discomfort, or shortness of breath, don't brush it off. Listen to your body and seek medical advice. To make the most of your appointment, here are a few key areas to discuss with your doctor. Mindful eating habits can play a bigger role than many people realize. Eating smaller meals, chewing slowly, and avoiding late-night eating may support better digestion. You might want to ask your doctor how paying closer attention to what and how you eat could support your heart health and help manage your symptoms. Identifying triggers is also important. Keeping a food diary can help you recognize patterns linked to digestive discomfort. It's worth discussing whether certain foods, activities, emotions, or stress seem to make your symptoms worse. Recognizing these patterns could be key to managing them. Changes in body position, like sitting upright instead of lying down, can sometimes make a noticeable difference in how you feel. If you've noticed this, be sure to mention it. Small details like these can give your doctor important clues about what's happening inside your heart. Sweating when you're not exerting yourself? Sweating during a workout is normal. But sweating excessively while sitting still? Not so much. A cold, clammy sweat could be a sign of a heart problem. Some people experience unexplained sweating as an early warning sign of the heart not pumping as well as it should. This makes it one of the symptoms to be aware of when thinking about heart health. If you suddenly break out in a cold sweat and feel weak or dizzy, don't ignore it. Seek help immediately. While your doctor is best equipped to evaluate your symptoms, here are a few aspects you might consider mentioning during your visit. First, temperature awareness. Noticing when and where excessive sweating occurs, for example, stress-related or nighttime, can provide useful information to discuss with your doctor. Next, breathable clothing choices. Loose natural fabrics may help regulate body temperature. Ask your provider if this can benefit your situation. Now on to stress reduction strategies. Stress can sometimes trigger excessive sweating. Relaxation techniques might help. But check with a professional for the best approach. Jaw, neck, or even upper back pain isn't always from bad posture. It could be your heart sending a distress signal. Many women report jaw, neck, or back pain before or during a heart attack. If this pain appears suddenly or alongside other symptoms, don't ignore it. Go get checked out right away. When talking with your doctor, consider bringing up these points to get a clearer picture of what's going on. First up, posture and ergonomic adjustments. Not all jaw or neck pain is a heart red flag. Sometimes, it's just the way you're sitting or working. Poor posture can create tension, so it's worth asking your provider if ergonomic tweaks might help. Let's move on to stress awareness and jaw clenching. Stress can sometimes trigger jaw or neck pain. However, many people don't realize they're clenching their jaw until the pain sets in. If that sounds familiar, talk to your doctor about strategies to ease that tension. And finally, gentle massage or warm compress can help if the discomfort is muscle-related. Just be sure to get your doctor's okay first, especially if the pain is sudden or unusual. Want to know if your heart is at risk? Do these simple checks. Check your resting heart rate. A normal resting heart rate is between 60 to 100 beats per minute, or BPM. If yours is consistently over 100, it could be a warning sign. Monitor your breathing. If you can't complete a sentence without feeling winded, your heart may not be pumping efficiently. Test for swelling. Press on your ankles. Does the skin stay indented? This could indicate fluid retention from heart strain. If you experience any of these symptoms frequently, it's important not to ignore them or brush them off. Instead, take a proactive approach. Are you wondering what to do next? Let's walk through your action plan. 1. Track your symptoms. Note when they happen, what you're doing, and how long they last. 2. Don't delay. If symptoms persist, worsen, or occur with others like shortness of breath or nausea, seek medical help promptly. 3. Talk to your doctor. Share your symptom journal and ask specific questions like, could this be heart-related or muscular? 4. Get evaluated. Ask your doctor for a heart screening. Your provider may recommend blood tests, an ECG, echocardiogram, stress test, or other diagnostics to rule out or confirm heart involvement. 5. Make small changes today. Even simple habits like managing stress, moving more, and eating heart-healthy foods can help reduce risks. Recognizing these hidden heart warning signs could save your life. If you're experiencing any of these symptoms, don't ignore what your body is telling you. Talk to your doctor. Early detection and treatment can help prevent heart attacks, strokes, and serious complications. If this video helped you, hit that like button and subscribe for more expert health insights. And don't forget to share this with friends and family. It might just save a life. Stay informed, stay healthy. Take care of your heart because it's the only one you've got.